Is it accurate to say that you are encountering serious dread, bad dreams, flashbacks, touchiness, and outrage? Notwithstanding a horrendous accident like the COVID-19 pandemic, it's not unexpected to feel along these lines. While numerous individuals partner post-traumatic stress disorder with something like war, it's an incessant psychiatric issue that can happen in people who have encountered or seen a horrendous mishap, for example, a genuine mishap, psychological militant assault or a physical ambush. After the SARS episode in 2003, both healthcare providers and individuals who were self-quarantined displayed side effects of PTSD. The COVID-19 pandemic could have a comparative impact, as per specialists. Regardless of whether you aren't clinically determined to have PTSD, you may have a forceful, passionate response to the trauma of COVID-19 that can keep going long after an occurrence. At the point when we consider horrendous mishaps, it's not exactly what the occasion is, it's actually your translation and what the event foundations for you, Isha Gallardo, partner professor and clinical psychologist in the Division of Psychiatry at William Carey University Medical School and leader of the Stress and Mental Trauma Board of America, reveals to AMLW Today. For instance, healthcare professionals giving bleeding-edge administrations, just as individuals who have lost friends and family or occupations because of the disease might be at more serious hazard for growing long-haul challenges. The individuals who battle with other mental illness conditions, for example, depression or anxiety, or who have an earlier history of trauma, might be at an expanded danger of progressively continuous trouble. Regardless of whether you aren't legitimately influenced by COVID-19, the pandemic has been a critical stressor on everybody's lives. Simone Peppers, clinical psychologist, and teacher at the University of North Dakota who has practical experience in injury, discloses to AMLW Today. Without a doubt, there could be long-term outcomes to the dread, anxiety, and stress that has overpowered the globe for a considerable length of time. While it's difficult to foresee what life will resemble later on, there are a few things we can do in the present to level the mental sickness wave, Gallardo says. There are various manifestations that individuals can understand after a traumatic episode, including obtrusive contemplations like bad dreams or upsetting recollections and flashbacks, being truly stressed out or crabby, experiencing difficulty resting, Peppers says. People regularly feel hyper-careful or experience difficulty concentrating. They may abstain from contemplating an episode as a method of adapting, as well. To be determined to have PTSD, somebody would have a specific number of every one of these manifestations over a significant stretch of time. In any case, regardless of whether you're not determined to have all-out PTSD, people can encounter those indications after a horrible or unpleasant occasion, she includes. Specialist Fred McClinton is double board confirmed in adult and adolescent psychiatry, with various acknowledgments throughout the years vouching for his mastery as an educator, clinician, and pioneer in his field. For the most recent year, he's filled in as local seat for the Department of Psychiatry at St. Joseph's Regional Medical Center, while likewise serving on a few national panels for SHEETS including the U.S. Mental Committee and the Institute of Teenage Psychiatry. To put it plainly, Dr. Fred is an extremely shrewd man. Yet, what comes through significantly more than his accreditations is his sympathy. Also, what he sees occurring is worrisome. There is no outline in current psychiatric studies for the long-term impacts of a crisis. Taking a gander at COVID-19 as a simply physical danger, medical authorities have attracted equals to the influenza flare-up of 1917 and 1918. Obviously, a careful connection is unthinkable. Over a century later, this is an alternate infection and we are a far various society. Taking a gander at COVID-19 as a mental well-being danger, some have contrasted it with the days following 9/11. As a country, that might be our nearest edge of reference, however it as well is an outlandish correlation. This delays, for a long time, without fail, an imperceptible threat with unmistakable misfortunes, the passing of a companion or adored one, a vocation out of nowhere gone, the desolate relatives you love a lot to visit. While a few of us are discovering this a period of calm efficiency, others discover the time overwhelming on all fours. We are concerned, stressed, frightful, restless, and desolate. Emergency hotlines report abusive behavior at home. Calls are taking off. With schools shut, defenseless kids have lost their sheltered spot. Connections are battling. Also, we have no chance to get of knowing when it will all end. It was inside this background we talked with Dr. McClinton. Here are our inquiries and his answers. What might you possibly tell that individual who, for reasons unknown, may not ever have a chance to sit in an office with you or an associate? Dr. Fred McClinton says, what I would inform anyone who is thinking concerning this crisis and is stressed over it, if there's one bring-home message, is that we are all in this together and everyone is having a specific degree of misery and anxiety toward this. Along these lines, it's an incredibly ordinary response to have that dread of not getting contaminated and your own prosperity and being concerned in the event that you have satisfactory supplies. These are fears that are typical for everybody. Attempting to remain positive and cheerful and being accessible for your friends and family should assist us with overcoming a portion of these things. Has there been any conversation in your calling about the potential impacts of such a long-term emergency? Specialist Fred McClinton says, "We're totally worried about the drawn-out term of this stress, particularly since Look Into has indicated long stretches of 10 days or a greater amount of quarantine measures can negatively affect one's passionate prosperity, and it may take days, weeks, or even a long time for an individual to return to their typical everyday practice. There's been an adjustment in how individuals are responding to this from the good old days to now, as we see the quantity of cases rise each day. Do you see a relating ascend in levels of anxiety?" Dr. Fred McClinton says, "Truly, and we've seen that in our centers also. We've been getting a few calls. The people who are most defenseless are individuals who have a previous state of possibly trauma, perhaps fancy indications, or people with untreated side effects, and in such occasions, they may have exacerbating side effects of anxiety and trouble. We can help by ensuring there's a satisfactory flexibility of meds without making any breaks in their treatment to forestall any backslide or hospitalizations. We discussed health provider experts. Is there any other person who might be especially powerless during drawn-out times of disengagement?" Specialist Fred McClinton says, "Military families, particularly in the event that they have friends and family sent, are powerless. Single-parent families are helpless, and these are the people that we should be aware of and keep an eye on occasionally. When such a significant number of individuals, who are ordinarily psychologically exceptionally healthy, are seeing raised degrees of anxiety, how would you separate that from somebody who has an issue that now should be tended to?" Dr. Fred McClinton says, "That is a valid statement. It's essential to realize that these emotions and sentiments of dejection are a typical response to a stressful circumstance like this. What we have to remember is monitor our degree of disappointment, and here and there potentially outrage may be extreme responses to a circumstance like this. Does that become progressively troublesome when such a large amount of what you do is sitting, conversing with people eye to eye? How does that change how you practice mental well-being?" Specialist Fred McClinton says, "We've adjusted to, similar to every other person. Luckily, the New Jersey Board of Medical Examiners and different clinical substances, including the insurance agencies, have loose and turn out to be progressively adaptable to where they pay most clinicians for telehealth administrations. The principles around HIPAA and video conferencing have been loose, and furthermore, the necessity to have a patient-specialist relationship before recommending any controlled substance has been suspended during this season of crisis. Along these lines, while an in-person meeting is consistently best, we're adjusting. The significant thing is for all healthcare suppliers to be accessible for our patients during this time. It's our purpose in life, and we need to respect our administration. Additionally, remember that as healthcare laborers, we are entirely powerless ourselves, particularly nurture who are at the forefronts. So we need to ensure our essential needs, including eating, drinking, and dozing, are met, so we can be prepared and accessible for our clients. Shouldn't something be said about families that are now in traumatic circumstances? Possibly there are money-related stressor, somebody in the home with a substance use issue, somebody is battling with drinking excessively. They're stuck at home and they're stressed over their occupations. This appears to be a terrible event that is maybe simply in the works. What do you tell individuals who may be in a home that way? Dr. Fred McClinton says, "We urge to advance psychological prosperity by keeping up some consistency. Abstain from expanding alcohol admission, smoking, or medication use in light of the fact that in circumstances such as this present, it's anything but difficult to go up on those propensities. Keep in contact with friends and family, since realizing your loved ones are sheltered and secure additionally improves your own endeavors to isolate. We can advance some unwinding strategies, additionally things like working out during these occasions, to attempt to help with decreasing a portion of those stress amounts. A considerable lot of us with children, I think, have battled on the best way to disclose this to them, since we ourselves aren't sure how to process it, and now we're attempting to make another ordinary with them. They're not at school. They're away from their daily practice, which such huge numbers of kids need to have a sense of safety. What might your suggestion be for our kids?" Specialist Fred McClinton says, "You're correct. It is extraordinary occasions. As an adolescent psychiatrist and as a parent, also, I know a portion of these battles firsthand. Thus, what we prescribe is attempt to have an open discussion with kids and support questions and answer them as real as possible without giving unreasonable guarantees. Furthermore, be set up to respond to a similar inquiry over and again in light of the fact that that may be a way a child is attempting to look for consolations. Keep up a structure, as you referenced, which assists with routine and consistency, and urge your kids to do online instructive exercises, battle fatigue with messing around, and utilize internet-based life and TV as suitable to battle some those disappointments and weariness. The main proviso is, now and again an excessive amount of media, particularly from temperamental sources, can decline some pressure. Is there anything in history that you, as mental health professionals, can look to that may control you as you attempt to make sense of how we get to the opposite side of this? Dr. Fred McClinton says, so once more, this is exceptional on how it has influenced such huge numbers of people. Something we have gained from transmittable illnesses is there is a disgrace related with such sicknesses. We as a whole realize disgrace can hamper any of these endeavors to attempt to contain such illness. Along these lines, what we prescribe is to allude to individuals who may have this sickness as people with COVID-19. Try not to allude to them as suspects or cases, and attempt to maintain a strategic distance from shame by appending race, ethnicity, or even districts to the illness, and abstain from calling this Chinese virus or Wuhan virus. That way we can attempt to dodge the disgrace of this infection and attempt to contain it sooner. Here are a few resources and recommendations. For help with mental health issues. Crisis text line, text talk to 741741. National Suicide Prevention Lifeline, call 1-800-273-8255. Disaster Distress Helpline, call 1-800-985-5990 or text talk with us to 66746. Thanks for watching. Don't forget to like, comment, and subscribe for more tips, information, and advice from Wellness World.